Some years ago, I did a few videos on living with HS, hidradenitis suppurativa, and my experience as I was preparing for surgery. And I did some videos on what the surgery was like, the recovery, and I wanted to just come back here. It's been a long time, but I wanted to come back here and really just talk about what my skin disease has been like since the surgeries. So I think I had those surgeries on both of my armpits in maybe 2017, I want to say 2017. It might be 2016, 2017. Gosh, time is flying by. So some of my YouTube videos, you may see that I have bandages on. um, I did my surgery through the VA healthcare system, and I met my surgeon a few weeks ago, and we had a brief encounter. He didn't remember me, but I talked to him about the disease, the condition, the severity of my HS, and he remembered. And I shared with him that I believe he effectively saved my life, because I was at my wits' end with dealing with the pain and getting cut. And if you're new to HS or not new to HS, you understand better than anybody. Those are the two things we deal with the most: the cutting and the need for pain relief. So I opted for surgery because I tried Humira. I was doing a lot of the incisions, lancing and draining incisions, whatever, in the doctor's office or the surgeon's office. And finally, we just decided you need to get surgery. And while the recovery from the surgery was tough, it was um, mentally draining as much as physically draining. It was worth it. My arms, I did a total of 3 surgeries on my arms, my armpits, and I did 2 surgeries on my thighs, inner thighs. And I can say that the HS is in remission. I do still deal with the polinidal cyst that is on my tailbone. Seems that it won't go away. It flares up about 3 to 4 times a year, and because there's so much scar tissue from repeated cutting and surgeries, ineffective surgeries, there's so much scar tissue that it feels like when it wakes up, it is angry, and it's really deep, deep, deep in the tissue. And sometimes I have to go into an operating room just so they can drain it. The polinidal cyst, it accompanies HS. You don't have to have HS to have the polinidal cyst. You don't have to have polinidal cyst in order to experience HS. I had both, and had to treat both separately, and the HS is just hanging on. I respect the polinidal cyst, um, because it just flares up when it wants to, and it won't always go away. So anyway, I just wanted to kind of give you an update. If you ever came across my YouTube videos around the time when I was contemplating surgery and the times when I actually did have surgery and what that recovery was like, I just wanted to let you know that I'm still here. I have had quite a few surgeries, and they have been effective surgeries, and that I am living with a polinidal cyst, and I respect my skin. And I had a doctor tell me, surgeon tell me, he introduced me to an intern. I don't know the right word for medical folks who are learning. Um, her skin has not been kind to her, and I almost hate that he said it, but it stuck with me. It hasn't been kind to me, um, but it's just skin, and I try to keep that in mind, that it's just skin. It's not all of me. So while my skin has not been kind to me, I have been focusing on being kind to me. Maybe my skin will catch up. But anyway, um, I've seen comments. I know people are still finding my page, my YouTube channel, and they drop comments every now and then. But you who are newer to the HS diagnosis, or maybe you're not diagnosed yet, you're doing your own research, and you're thinking it's HS, my heart goes out to you, because I know what it's like. I know how lonely it can be. I know how painful it is. I know how there are just some days you really just want to cry out, because it's painful, and it's It's just a mess. A lot of bandage changes. I have been there. I see you, I hear you, and I empathize with you. I just want to encourage you to explore your options, join support groups, leave comments here. I'll do my best to respond to them if there's something I can be helpful with. And, hang in there. You do not have to deal with this alone, even if it feels like it. You got to find people who understand what you're going through, and more importantly, you need to find medical professionals who are going to listen to you and personalize your treatment options for this disease, because HS has, some days it feels like it has a mind of its own. So, and then there's a lot of influencers out now with it, and they're pretty open about it, which I'm happy about, because I suffered in silence apart from doing a few YouTube videos here and there. So anyway, that's my update. I think my HS surgeries have been effective, and just living with the polinidal cyst. So hang in there. I see you. I hear you. You're not alone.